Good morning, everybody. Sorry for all the little technical bleepers there, trying to make sure we're going live on Facebook. I'm Andrea Leonard, and we'll get started in just 2 minutes. I would love to know where you are from and what brings you here today. Are you a cancer patient or survivor? Are you a fitness professional, medical professional? Would love to hear where you're from. I know usually we have people from all over the world, which is amazing. You guys can write in the chat box, and I will try and answer questions as we go along, but if need be, I'm going to wait until the end to do it so we don't get too off track. And if you notice, I don't know if you can tell looking out the window, it snowed and it is freezing here. So I'm like, ooh. I have a heating pad on just because I'm chattering. Welcome, Jessica and Vincent. It looks like, okay, Brooklyn, Connecticut, New York City, Central Virginia. Hi, Jan. I love it, actually. I know, as I complain because but I'm in Colorado. We got, I don't know, maybe 8 inches of snow the other day. Is the sound weird? Let me know, you guys, so I can try and figure it out. Ocean City, Maryland. Oh my God, my stomping grounds. I grew up in Rockville and used to go to Ocean City all the time. So I was a super 80s Ocean City girl. Okay, so before I get started with this, can you all hear okay? Welcome, Angela. Welcome, Matt. Okay, so Angela, I'm going with your yes. So Matt, maybe it's your sound, but let's get going. And like I said, I will answer questions as I can throughout and definitely at the end. My name is Andrea Leonard. I am a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. Thank you all for being here. So far, I see everybody in the good old US, but I'm sure we will have people from around the world, and welcome, welcome, welcome. So our topic today, of course, is exercise and its effect on cancer treatment and recovery. And I can tell you firsthand, one, being a 36-year cancer survivor, and then second, I've been in the fitness industry since 1984 and been a personal trainer since 1992. And it has certainly had a profound effect on my emotional and physical recovery from cancer. What inspired me was, actually, it was my mom's second diagnosis with breast cancer, which was in 1995, 96. And at the time, she had asked me if I would help her recover from her mastectomy and breast reconstruction, because after the first time she had had a frozen shoulder, permanent nerve damage, was never told about lymphedema, which I'll explain to you guys. And I happened to be working with her breast surgeon, and I said, what do you think about writing a book on exercises for breast cancer survivors? That's a great idea. Now, there was nothing out there back then, and the internet was just getting started. So we enlisted the help of the chiefs of breast surgery at Georgetown, GW, and Johns Hopkins universities, and spent 3 years working on essential exercises for breast cancer survivors. And as time went on, my personal life was affected more and more by cancer. My father had prostate cancer, bladder cancer, myelodysplastic disease, and I had 23 first-degree relatives with various forms of cancer. So I realized there was a much greater need. And although breast cancer is huge, it extended beyond that. So I founded the Cancer Exercise Training Institute with the hopes of educating other health and fitness professionals to empower cancer patients and survivors through their journey, because I can't do it alone. So we have now trained over 12,000 people in close to 40 countries, and am just thrilled. Unfortunately, I lost my dad just about 6 years ago next month, and my mother currently is fighting stage 4 breast cancer, but she's fighting the good fight, and we're doing everything we can. So Here we go. Exercise can, in fact, reduce treatment symptoms and improve treatment tolerance. I'm going to break this down into each and every category, and I'm sure there are more, but these are the primary ones, and especially as it pertains to what we can do in the health and fitness world, because there are a lot of holistic ways of fighting cancer and other methods other than what we consider conventional. But as a health and fitness professional, we're limited to working with diet and working on exercise. Now, if you happen to be a physical therapist or an occupational therapist, nurse, or someone else in the medical arena, then of course you have some other things at your disposal, where with fitness we're a little more hands-off. But exercise can, in fact, reduce nausea and increase appetite. And this is affected with many people, especially those going through chemotherapy, who often they have sores in their mouth, they may have a metallic taste in their mouth. There can be any number of issues, but the actual exercise itself has been shown to increase appetite. And it's really important because many cancer patients will suffer with what we call cancer cachexia. If you were to look at the spelling, it actually looks like cachexia. However, this is what we call muscle wasting, and it is a big issue with cancer patients. 76% of cancer patients report extreme fatigue. And so we all know that the endorphins that are produced during exercise can increase our energy, give us that boost. And this is so important because many patients that I've worked with have literally said that they cannot get out of bed, or if in fact they are working, they are continuing to, do the things they have to do in life, that's it. That's all they have the energy for. They get home and they can barely get up a flight of stairs. So it's really about the proper equation, which I'm going to talk to you about as we go through this. But increasing energy is incredibly important, and of course can make the whole process much less emotionally and physically painful. And as I mentioned with cancer cachexia, many people are losing lean muscle and unfortunately gaining body fat. So even if their weight stays the same, they may find that they are going up a size or two sizes. And of course, the weight is the least of our concern. It's all about a healthy body composition, because unfortunately, there are a number of comorbidities associated with cancer treatment. And unfortunately, body fat, an increased percentage of body fat can lend to that. It can be very difficult to sleep, and people may have pain. They are, have incredible amounts of stress and are revved up. Their mind is going a million miles an hour, processing treatment decisions. Who's going to take care of their family? How is this going to affect their marriage? Are they going to have a job? And all of these things can affect sleep, as well as steroids, which can tend to keep people up. So exercise has been shown to improve the quality of sleep. And these points that I'm making to you are not just random things that I've pulled out of a hat. There are many studies that you can certainly look up, and we have cited throughout our educational materials. So it is proven. Exercise also is shown to decrease pain. Once again, we get back to the endorphins. And while people are exercising, of course, that gives you, in a sense, a false sense of euphoria, which can be temporary. But when we see people participate in regular exercise, and the American College of Sports Medicine put out some new standards, which came out just about a year ago. And the goal is 75 minutes of high intensity exercise, cardio, or 150 minutes of low to moderate. And then, of course, incorporating yoga and mind-body exercise. But the thing is that it's not a one-size-fits-all equation. Those would be the goals, but every cancer patient cannot exercise for 150 minutes a week or maybe even 50 minutes a week. So we have to understand how and when to safely and effectively progress their exercise program. And for some people, it may start with just a few minutes a day. So many people are suffering with depression, and this is, an epidemic worldwide. We are seeing increased depression and unfortunately rates of suicide with COVID. So imagine those people who have cancer. And I'm going to give you my mom as an example. She is in Maryland. And so I'm 2,000, 3,000 miles away, depending on where I am at the time. And while I did go out there last week, it was a huge risk because obviously I'm on a plane and don't know what I may be bringing when I get off the plane. And so I don't know when I'll be going back. So my mother is all alone. And with COVID and cancer, she's petrified to walk out her front door. So the isolation is overwhelming. And you've got people who are dealing, in my mom's case, with end of life and, trying to be as healthy as possible, but relying on other people to get your food, to, safely get you to and from your doctor's appointments. And even those are difficult now because the doctors don't want to see you unless it's an emergency. And so depression is very, very real. And exercise has been proven to decrease depression, improve overall mood. And I would say right now, this is critical. And also improving activities of daily living. Now, of course, we've got an elderly woman in this picture, but this can apply to anybody. If it's a child with cancer, activities of daily living may include, playing with their fellow schoolmates or just being able to stay awake long enough to do their homework and not fall behind. And for somebody who is aging, to go for a walk, to get to the grocery store, to cook, to clean, to perform self-care, all of those things can be affected by cancer treatment and, surgery and recovery. And overall, exercise has been shown to improve quality of life and increase satisfaction with life. So in many polls that have been taken and studies that have been done, it has been overwhelmingly I guess, known that there is, in fact, an increased satisfaction with life. And it can lead to a faster, better recovery. So if we were to take a group of people who, 10 different people who all had a mastectomy on October 1st, 2020, and each of them had an axillary lymph node dissection, and we took a certain group and they did cardiovascular, they did range of motion, and at some point they were doing strength training when they're ready. Compared to those who didn't, we would see a tremendous difference in those two groups. And those that had been participating in exercise would be getting back to their lives the way they knew it. They were feeling better physically and emotionally. So I'm going to break this down into all different aspects of fitness, starting with range of motion. Now, I want you guys to do a little test here, if you will. If you will grab your pec minor and hold it really tight, bind it down, and then try and move your arm through abduction. Try and move your arm through flexion, through extension, and see how difficult and possibly painful that is. Well, imagine someone who's undergone, let's say, a mastectomy or radiation to the chest or breast reconstruction, or it could be surgery or radiation for any type of cancer. But as they heal and there is the formation of scar tissue and adhesions, it can have that same effect, limiting range of motion. And not only is this painful, but it's functionally limiting. So we must help our clients to regain their range of motion in each of those planes prior to adding any strength training or any load. Now, I know that in this picture, this person is using a band, but we're not putting the cart before the horse, one step at a time. Many muscle imbalances can ensue following surgery and reconstruction. So I'll give you an example. With breast reconstruction, there are certain procedures that actually use the latissimus muscle or the rectus abdominis muscle to reconstruct the breast. So not only are we moving masses around, which cause, let's say, for example, we've got the pec, then we have an implant, then we have the latissimus muscle on top of there. Obviously, you're going to have protracted shoulders, forward head, weakness across the back. Or what if someone has a sternocleidoid mastoid muscle removed during a radical neck dissection? Then through the process of synergistic dominance, you've got the levators and the upper traps and the scalenes all compensating because the SCM muscle is no longer there. So this, of course, results in muscle imbalances. And if these are not identified and corrected, we can see long-term joint degeneration and, of course, acute or chronic pain. So the assessment process is critical prior to doing any exercise programming with your client going through cancer. I'm just checking in on the chat box again, just to see if anybody's writing anything. We have awesome Chris, we've got you here from Ontario, Canada, and then Sally from Niagara Falls. Thank you all for sharing who you are and what you do and where you live. Keep writing to me in the chat box, makes me feel not alone. Okay, lymphedema. Lymphedema is the swelling of the affected area. It's usually an extremity, so legs or arms, hands and feet, after removal of lymph nodes or radiation to a specific area. Now, this may be one of the best kept secrets. So many cancer patients are unaware that they're even at risk for lymphedema. And unfortunately, this is a lifelong risk. The risk does not increase or decrease with time. And that means as a health or fitness professional, you need to understand, first off, if your client is at risk, second, where they're at risk, then know to incorporate lymphatic drainage exercises to start and progress slowly with that part of the body, because we don't know what their lymphatic system can handle anymore. They have, they have a new body, if you will, and we have to start from the beginning. You can't go back to where they were before. And in some cases, that's okay because people were completely sedentary. But this is not only, the best kept secret, but it's often overlooked by health and fitness professionals. And this is critical, you guys. You have to understand lymphedema and all of the complications with range of motion, strength, ability to perform activities of daily living. There can be pain, discomfort, and then disfigurement that goes along with it as well. And comorbidities that are associated with different cancer treatments. I mean, chemotherapy, let's face it, you cannot, put a toxin that is able to kill cancer cells into a body and not expect it to wreak havoc on some of the healthy cells as well. So the long-term side effects of chemotherapy can include diabetes, osteoporosis, damage to the heart and lungs, and future cancers. And these can be compounded by other treatments, hormonal therapies that cause instant menopause for women and menopausal-like symptoms for men also increase the risk of osteoporosis. And the weight gain from hormonal therapies increases the risk of diabetes and heart disease. And it also increases the risk of lymphedema, because adipose tissue retains fluid and can interfere with the flow of lymph. So we have to determine in any given exercise session what is most important for our client right here, right now, today. And that may be different than next week or next month. And we're not going to get through all of this today because obviously, we have an hour together and there's so much information. Rosemarie from Tennessee, 28 years out from breast cancer. Congratulations and welcome. So you had a tram flap, which is using the rectus abdominis, and how debilitating that is, how difficult a recovery it is. My mom had that too. Quicker return to work. This is huge, for people who are providing for their families, especially if they're the breadwinner in the family. Not only do you have all of the hospital costs from the surgeries, from the treatments, but you're out of work. So the sooner we can get people back on their feet and safely returning to work can make, a huge difference in every aspect of their life. And then, of course, with determining what exercises they need, especially if it's somebody who has to do physical work, that plays into what is most important right now. And we know exercise is medicine. It is. A doctor cannot cure cancer. There is no magic pill. There is no magic, surgery that's just going to fix everything. But exercise has been proven over and over to help people become healthier and fight off disease. So the key here is what exercise, how much, and that's where it really is a prescription. And, if you are working with cancer patients and you do not have proper training, you're doing yourself and your client a disservice, because potentially you're putting yourself at risk legally. And obviously the bigger concern, well, maybe it's 50-50. I guess it just depends how you look at it. But certainly putting someone else's life at risk because you don't know what it is you're supposed to be doing with this person. I don't like that one, especially since I am a cancer survivor. Okay, Sally, thank you for sharing. Post-Whipple surgery, you're asking about best exercises generally. Let's get through this presentation, and then at the end, when I have, do Q&A, let's talk about that a little bit more, okay? All right, so how might physical activity actually be linked to reduced risks of cancer? Well, for one, it can help lower the levels of certain hormones like insulin, estrogen, and even growth factors that have been associated with cancer development and progression. And specifically, studies have seen this with breast and colon cancer. And we know that exercise can help prevent obesity, which is also linked to a number of different types of cancer, as well as reduced survival rates. And of course, with obesity, a lot of people develop insulin resistance and become type 2 diabetic. Inflammation. If you were to take one thing and say, there was a direct link other than genetics to cancer, it would be inflammation. So reducing inflammation throughout the body can not only reduce the risk of cancer, but many other diseases. There's been so much about glucose intolerance and inflammation, whether it be from glucose or from dairy, and all of that is the effect of inflammation on our bodies and our body's response to that inflammation, and that actually affects the immune system. Not positively. Unfortunately, that depletes the immune system, and then you've got your immune system working on overdrive. Also, exercise can help speed up the passage of ingested foods so that they are not, as they become waste, we are minimizing the amount of time they are in contact with the mucosal lining of the stomach. So basically, exercise is going to make you go number 2. Gotta keep some sense of humor here. It is such a heavy subject, and it is not for everybody. Obviously, if you go to something like an IDEA convention or, Fitness Asia or any of the others, CanFit Pro, you go to the classes, the fun ones, with the BOSUs or kickboxing or the latest yoga lattes. The classes are packed, and everybody's like, yeah, rah, rah, rah. And then you go to something on medical exercise, and, there's a good good presence there, but not nearly as much, because cancer isn't pretty. Cancer isn't fun. But you know what? In your career as a health or fitness professional, and I can tell you this because I've done it all over 28 years, you will never have a greater satisfaction from what it is you're doing, and from by truly, truly changing someone's life, giving them back their life, because cancer strips you of everything. Cancer can take your hair, your breasts, your testicles, your job, your wife, your husband, your partner, your finances, your self-esteem, your self-confidence. And as a cancer exercise specialist, I have the ability to help somebody regain control of their lives and their bodies at a time they feel they have none. And I know those of you out there who, have been through this or are currently going through this. Linda's like, rah, rah, rah. I know it is a little rah, rah, but I am sincere. I am totally sincere. And anyone who's followed me or known me, you know that, because there are many different avenues any of us can go down. And this isn't for the faint at heart, but if you are inclined to, level up and take your education to that next level of medical fitness, I guarantee you this will be incredibly rewarding for you as well as your clients. Along with range of motion, of course, we have just the general aging process. We have a decrease in flexibility, and that can be exacerbated, when people have downtime, when they're sedentary. You don't use it, you lose it. So we can help increase range of motion after surgery and radiation, helping people to improve activities of daily living and increasing lymphatic flow. So as we open up these lymphatic pathways, we help the lymphatic fluid to circulate throughout the body, perhaps reducing the risk of lymphedema, or if someone does have lymphedema, minimizing the swelling in the affected area. And then I had mentioned to you about mastectomies and reconstruction and radiation. And this isn't about breast cancer today, guys. This is about all cancers, but you can visualize this, okay? So imagine 2 horizontal incisions here. And then on top of that, you irradiate that skin. So it becomes, scarred down, possibly adhesions. And then on top of that, maybe a year later, we open it up and do breast reconstruction. And now there's more surgery, more scar tissue, more adhesions. What can happen is the pectoralis muscles can actually go into painful spasm, and that can cause ischemia or lack of blood flow to that area. So many cancer patients, and yes, I'm giving you a breast cancer example right now, but many cancer patients who complain about pain, it can in fact be the result of lack of blood flow to that area. So as we open up and unrestrict those pathways, as we strengthen the opposing muscle groups so that they can have good posture, oftentimes we will see a dramatic reduction in pain. And that will also improve posture. So, we see this on the computer. Everything we do is in front of us for the most part. And, yet people are still in the gym doing chest work, whereas they should really be focusing on strengthening the back, opening up the chest. And it's all a progression, but you have to know what to do and when, and ultimately that will result in improved performance. But there is a point where somebody may not be ready for a particular exercise. It could be too much and you have to ease into it. There should never be any pain, maybe just a mild discomfort. So if somebody is saying, ouch, then they need to back up, back off. And obviously they can be limited by pain and fear. Now, a lot of times people have gone through physical therapy and it's painful. I mean, whether it's cancer or you're recovering from, shoulder surgery, recovery is a difficult process. And so they may be afraid to go to the gym, to work out with a trainer, to do yoga, to go swimming. And I think that we as a cancer exercise specialist can provide a safety net for that person. But that means you need to know what you are doing so that you don't do or don't have your client do too much too fast. Now, yoga and meditation is critical. It's a critical component. And while everyone does not do yoga, Everyone can practice deep breathing, everyone can meditate, and everyone can practice gratitude. So often what I'll do is I'll incorporate this at the end of the workout, even if it's 1 minute of deep belly breathing, and for them to say out loud or in their head 5 things they're grateful for. Changing the focus from their disease to what's good in your life, because we can always find something positive even in the worst of times, which many of us are experiencing right now or know people who are. So yoga will help people to relax. When you relax, your muscles relax, and perhaps that can eliminate some of that ischemia, or rather than eliminate ischemia, I should say, should just improve blood flow and circulation to that area. And stress runs high with cancer. And we all know that there is a correlation with emotional and physical stress and disease. So helping to manage stress is critical. And if you can incorporate that into your training, that is just another great service that you can offer. And I'm not suggesting you claim yourself to be a psychiatrist or psychologist or even a life coach if that is not how you're trained, but you can absolutely work with people on some very simple ways to control their stress. And of course, exercise is one of them. Yoga and meditation can also help decrease depression and decrease pain. Remember, as they release some of that anxiety and the muscles loosen up, then a lot of that pain can be diminished as well. And yoga can also help improve performance in other activities as well. And yoga can be used to improve range of motion and burn calories. Obviously, we have restorative yoga, and then we have power yoga. Big difference in the calorie burn and the intensity. And while a cancer patient may one day be able to do power yoga, are they going to do it when they're in the recovery phase? No, absolutely not. I'm just reading Angela, 69 years old, 21-year survivor, 40-year fitness professional. Thank you so much, Angela. Angela's just saying thank you for the programming, and she's been involved in it, and I really appreciate that feedback. Thank you. Okay, so even with yoga and meditation, is it appropriate? Maybe somebody has to be doing chair yoga. Do you know how to modify a down dog for somebody who's recovering from breast surgery or head and neck cancer? If they're at risk for lymphedema, bearing weight on that limb for prolonged periods of time may be too much and increase their risk. So you must know the modifications. And actually in the process, I should have a brand new yoga book done, hopefully by the end of November. That is not a certification itself, but that, along with the cancer exercise specialist, you can be a yoga cancer exercise specialist. We're also coming out with a Pilates one by the end of the year. Yes, so excited. Thank you, Portia Page. Swimming is phenomenal. It will help people increase range of motion after surgery and radiation. Also great for arthritis if the water's warm, and lymphedema. The hydrostatic pressure of the water against the limb can reduce swelling and or prevent lymphedema altogether. It'll keep people cool during their workout, and that increased body temperature can increase the risk for lymphedema as well. So it's kind of finding this perfect balance of how hard to work. We want to increase the body temperature and circulation and burn more calories, but at the same time we don't know what their body can handle. Swimming, of course, will strengthen the heart and the lungs, increase overall strength, and burn calories as well. But when is it appropriate? If someone is immunocompromised, they're undergoing chemo or radiation, their blood counts are low, or they're recovering from a bone marrow transplant, or they're permanently on immunosuppressant drugs, they should not be in a pool, in a lake, in a river, because they may not be able to fight off the bacteria and can get an infection, and they don't have that strong immune system to fight it like a healthy person would. If they have a skin irritation, maybe from hyperthermia or from cryosurgery or from radiation, chlorine would be inadvisable. And if they have an external port There are ports that are surgically implanted. They're underneath the skin, and that's perfectly fine. But if there are external lumens, which are openings, then they should not be in the water. Cardio is so important to decrease fatigue. Obviously, the flip side of that is increasing energy, strengthening the heart and lungs. Many people who have undergone chemo and or radiation will have damage to their heart and lungs. And, the medical team is monitoring it, but we can also look for subjective improvements. How are they responding to the exercise that you're giving them? Are they breathless? Are they really struggling to perform the exercise? Are you seeing a notable improvement over time with the frequency, intensity, and duration? These are all things that not only can we look for, but we can also manipulate to be specific to that person's needs. Overall, cardio is going to help improve quality of life because we all need to have a strong heart and lungs to just perform our activities of daily living, to walk from point A to point B, to take care of our grandkids or our children. But we still need to know when it's appropriate, when it's too much, and you need to start and progress slowly with that as well if someone is at risk for lymphedema, because as their body temperature increases, there's also an increase in circulation of lymphatic fluid. We don't know what they can tolerate. So we start with just a 5-minute warm-up. And some people can't even do that. So we never push. And then gradually you can add intensity and duration, but not all at once. Because if your client ends up with swelling from lymphedema, and you've gone from here to here overnight, you don't know at what point it was too much. Maybe had you just gone to here, they'd be fine. So it's better to take baby steps and go slowly than it is to go really fast trying to get somebody back to where they were before, because you'll probably have more setbacks than successes. Also, you have to take into consideration the risk of falling. Does somebody have poor balance, and or do they have peripheral neuropathy? Now, peripheral neuropathy is burning, tingling, numbness, pain in the hands or feet, and it can be from chemotherapy, and it can also be from diabetes. And of course, diabetes can be a side effect of chemotherapy. But the bottom line is that if somebody has peripheral neuropathy in their feet, they should avoid high impact activities and those with the risk of falling. So what type of cardio are you going to have that client perform? We know that people need to do strength training. That's going to help reduce, bone loss, increase lean muscle mass, and burn calories. Of course, their basal metabolic rate is lowered during cancer treatment, and this can help to elevate it, and also improve quality of life, self-confidence, strength, and abilities to perform activities of daily living. But you also need to know when to incorporate strength training and when it's too much. So even if you're doing yoga and you have somebody hold a warrior one, but they have limited range of motion, they are doing isometric strength training. And if you do that prior to helping them regain range of motion, then that could be doing more harm than good. We must be able to assess shoulder range of motion, compare it to the norms, and we actually have specific norms we use, and then say you have to be at 90%, of this number before we add a load. And that could be bands, barbells, dumbbells, Pilates reformer, holding a yoga pose, you name it. Now, if somebody's using bands, you must make sure not to wrap a band around the area that's at risk for lymphedema. So if it's upper body, you're going to avoid putting anything on the arms or hands. If it's lower body, you don't want to place a band wrapped around any part of the lower body. And that's either leg, because we don't know which side that the lymphedema could happen on, where with upper body, it's going to be one or the other most often. And then, of course, this also has an implication with peripheral neuropathy, because if they have difficulty with fine motor skills, they could drop the weight, or they could let go of a band, and you can get hurt or they can get hurt. So understanding all of these things is critical before you start exercise programming. And of course, we always want to incorporate balance and core, which can be dramatically affected by a lot of these reconstructive procedures. You know, when you take the rectus abdominis and tunnel it up through the body to create breasts, now the rectus is still connected neurologically. If somebody were to do a crunch, which is pretty much physically impossible if both sides of the rectus have been used, but if one side has been and somebody did a crunch, their breast is going to contract, it's going to hypertrophy, it's going to relax, all of those things. And then the contralateral abdominal area is. So you need to understand what exercises you're having somebody do based on the surgeries that they've had done. Of course, this person needs to work on their balance and they need to work on their core, but working the external and internal obliques, transverse abdominis, multifida, core stabilizers. So yoga is phenomenal. But do we start there, or do we start with just having somebody stand on one foot, holding on to something so they don't fall, and see how they do with that? And then if they can do that, they stand on one foot and don't hold on. If they're wobbly, we go back to holding on. If that's easy, then maybe we put them on an RX pad. But there's always got to be a progression, and in some cases, a regression based on how they perform a particular activity. So obviously, strong core is going to help to prevent injuries. It's going to help minimize back pain. And you know, many people, particularly with the breast reconstruction, will have low back pain, but also with a number of other abdominal surgeries, because of the muscle imbalance where there's scar tissue and adhesions in the front that draws people forward, the low back muscles can become overstretched and weakened. And that can lead to low back pain and, of course, a muscle imbalance. So by being able to do a comprehensive postural assessment to determine what needs strengthening and what needs stretching, you can really, really put the personal back in personal training. And if you're a group exercise instructor, we do have suggestions on how to do this in group training. That's all part of the coursework as well. I just don't have time to get into all of that today. But hopefully you'll join Dan and I throughout the week. So also with peripheral neuropathy, obviously that's going to affect balance. So yes, they do need to still work on balance as long as it's not causing pain, but you want to make sure that you do so in a very safe fashion, and, you know, consider the exercises that you're choosing. So guys, think about this. This is just kind of a rhetorical question, but why do you think mainstream exercise programming fails when it comes to cancer patients? And if you do feel like writing a response in the chat box, I'll go through those pretty soon when we get into Q&A. But this is a really important, let's just call it a thought. Why does it fail? You know, why are cancer patients falling by the wayside? And how are we as an industry failing this population? Really important that everything we do is both safe and effective. So when you are putting together an exercise program for anybody, but obviously we're talking about cancer here, what is the purpose? So when you choose any exercise, what is the purpose? What are you trying to accomplish or help your client accomplish? And then you have to look at the risk versus the reward. So for example, working out at a higher intensity of cardiovascular is going to burn more calories. It's going to help to burn more fat. It's going to help increase the metabolism. Okay, that's the reward. But the risk for those who are at risk for lymphedema is that it may increase the risk of lymphedema by increasing circulation in a part of the body that has now been damaged, if you will. So we have to kind of weigh it, risk versus reward. And different circumstances will have different outcomes. Specificity. Why are you choosing a particular exercise? And how is that going to help that person? So if somebody wants to get back to a sport, then obviously choosing sport-specific exercises, still focusing on that slow, gradual progression, can be really important. But otherwise, Is what you're choosing relevant? You know, if you're doing something that's going to help improve somebody's golf swing, but they're not a golfer. This is a stupid example, I know, but how is that going to help that client? It's just a waste of time. So choosing the appropriate exercises is really, really key. And you cannot do so without a comprehensive health history, without complete knowledge of surgeries and treatments, as well as completion dates, where the incisions are, comprehensive postural assessment, range of motion measurements, probably a modified Thomas test, squat test, and any other assessments that are safe as well as beneficial for this person. So why should you do this, guys? Why should you become a cancer exercise specialist or a functional aging specialist? There is a huge need. We've got like 73 million baby boomers, I think, just in the United States, and 65% of them are going to get cancer at some point in their life. Now, obviously, you can get cancer at any age, but what we're looking at is the combination of these two populations that are underserved. The medical doctors are overwhelmed with the amount of people that they're caring for, and they don't have the training to work with people in exercise. So there is a tremendous need, and that equals a tremendous opportunity for you. So throughout this training, you'll work with Dan Ritchie of FAI and myself. We'll go through a series of webinars, as well as all of the book content and PowerPoints and practice quizzes and final exams, until you are get a passing grade and you are now a cancer exercise specialist and functional aging specialist. And as part of that, we're also helping you to build your business by, listing you on multiple directories and teaching you how to get out there through, different means. Right now, it's mostly social media and webinars because of COVID, but you can save over $2,000 by getting started in these programs. And it's not just CES and FAS. Get the breast cancer recovery, BOSU specialist, functional aging, group exercise. I can't even remember all of the things we're offering. You'll have to go to the site and check it out. But you can start for just $99 with the 4-payment plan. Or if you do one single payment, you're going to save $600. I know we all have to decide where we're going to spend our money, and we have a certain number of dollars for continuing ed. But I will tell you, as far as return on investment, either or both of these courses. So if you already have one or the other, you can email me at Andrea@thecancerspecialist.com, and we can set you up with a special price for whatever you don't have. But where I was going with this is really a career opportunity. And particularly with COVID and, having to do online training, seniors and cancer patients don't know where to turn. And, they have, maybe not while they're going through treatment, but, as with the aging population, they've put aside money for their retirement. They have the desire, they have the goals in mind, whether it be playing with their grandchildren or going, on a trip to Fiji, or whether it's simply being able to move without pain. They will place that as a priority. They have the time, they have the finances. They just need you to help them. So if you want to register or just learn more about the courses, you can go to ceti.teachable.com. When you're ready to register, use Kickstart 2021 for that discount. But now I'm going to turn this over to you guys, and for the last 15 minutes or so, I'll let you go ahead and ask questions if you have any. I'm going to try and read some of these that are already here. And thank you guys all for sharing about yourselves. Sally, you're saying it fails because instructors don't know how to talk to cancer patients and don't progress slowly and safely. And that is absolutely one of the ways we fail. Lack of education. And for, it goes to the clubs and the studio owners, as well as us as individual fitness professionals, because the bar is set too low. Everybody and their mother is marketing to the young, the healthy, the fit. And really, they're missing out on a huge population. You know, you think of all the hours that your gym or studio, or even you as a personal trainer, are not busy because people are at work. Well, guess what? People who are recovering from cancer are probably not at work or working limited schedules. And certainly people who are of retirement age are able to fill those hours. So this is a prime opportunity for you guys to add classes, for you guys to add individual training, and fill those times. But not only, you know, it's not just randomly filling it, it's filling it with valuable and educational training that is specific to these particular groups of people. Catherine, you raised your hand, and I don't know if you are able to unmute yourself since we're not in a meeting setting, but if you wouldn't mind writing in the chat box there, I will make sure to answer your question. And I'm sorry, that's kind of a pain to have to type it. But if you know some other way around it, just go ahead and unmute. I wish I could figure that out. Okay, let's see what else we got here. All right, so Sally, getting back to you, post-Whipple surgery, you know, that's really, it's quite complicated because you have to take into consideration, when did you have the surgery? You know, what exactly was removed? Because in some cases, with certain cancer surgeries, other organs are removed. So you guys have to know that if somebody, you know, has their pancreas removed, they're going to be diabetic. If they have their spleen removed, they're going to be immunocompromised. If they have their thyroid removed, that's going to affect their metabolism. So that's why we have to be able to understand all of the intricacies of any given surgery. And then also, Sally, you know, did you go through treatment? What treatment? When did you finish? I also need to take into consideration your current level of fitness, when the last time you exercised was. So you may want to reach out to me individually at Andrea@thecancerspecialist.com to continue this conversation. Okay, so you go to people's homes and do specific functional movements. That's awesome. And, you know, even if you're not a big fan of the webinars and doing virtual training, this is an opportunity for you to reach out to people anywhere in the world. We're not limited to a certain geographic area anymore. You know, I can be training somebody in Greece. I can be training somebody in Rome. I can be training somebody who lives behind me. And especially when people are immunocompromised, this is the safest way right now with COVID, and with the numbers increasing. Unfortunately, I think it's safe to say we're going to see a lot of businesses shutting down again. Yes, here, let me write it, Sally. So the email, guys, is Andrea@thecancerspecialist. My hands are so cold, I can't even type. Cancerspecialist.com. Okay, there we go. Now it is posted. All right, let's go back here to the Q&A. All right, Rosemarie. Hate to hear from younger instructors, as long as they move, it's something. Rosemarie says she's 74 years old, 34-year survivor, and teaches seniors silver sneakers in all areas. Her theory is, I learn what their capacity is and strive to show them what they can do to increase their strength, flexibility, etc. What do you say to someone who says, I am old, I cannot do what you do? Most of the time they're younger than me. That is a good one. You know, I often tell trainers to meet your client where they're at. So perhaps, you know, rather than try and convince them otherwise at the beginning, say, you know what, let's start here and see where we can go, because the sky's the limit, but I won't push you any harder than you feel that you can go, but let's see what we can do together. And, you know, that way you're kind of putting it in their hands. And you're right, you are going to have people who are, you know, kind of like doom and gloom. And then you're going to have people who are going to want to like get back right away and do more than they should. And both of these ends of the spectrum are potentially problematic. So, you know, I'd almost rather have the person who says, I'm too old, I can't do this, than the person who wants to do too much too fast, because it's harder to kind of restrain them and slow them down. But another thing is just, you know, are you willing to try? would you be willing to work with me to try, X, Y, Z? And think about the exercises that you're having them do, and think about what they need in their life. So how many people do you know that say, I can't do a squat, yet they have to go to the toilet? And even if they're not sitting on the toilet, they're squatting. They have to get up and down from a chair, in and out of a car. So, a lot of times people's perception of what they can and cannot do is a little bit skewed. So Rosemarie, I don't know how helpful that is, but hopefully that at least gives you somebody else's opinion. So don't see anybody putting any questions in here, but we still have 59 people here. So let's see. Jan says, if she can get somebody to try to do something, they're usually really surprised at what they can do. Yes, and isn't that awesome? I'm going to give you an example in let's say, closing. And I had a client, her name was Janice, and she had stage 4 breast cancer, and I worked with her for probably 10 years. And this is kind of happy, sad, unfortunately she passed away. But there was a point somewhere in the middle where she started to have difficulty with movement. It was a combination of balance. She had neuropathy, self-confidence, which was severely impacted. She was falling more often. And so she had a lot of fear. And she went on a cruise every year with her husband and looked forward to it. And so she had come back, and Janice was always like the light in the room. I mean, always positive and full of energy. And she had gone to her physical therapist and said, do you think next year I'll be able to just use a cane? Because at the time she was on a walker. And the physical therapist said, no, I think next year you're going to be on a scooter. It was as if that physical therapist took a needle and popped it in her balloon, and it just, and her Janice's expression just completely changed, and she lost that zest for life. And I said, you know what, Janice, no one can tell you what you can or cannot do. And the Reader's Digest version is, I put a chair next to a treadmill so she could hold onto the treadmill for balance. And I said, we're going to do a squat. And, she's shaking and she's scared of falling. And I'm like, we're going to do like Pavlov's dog. I'm going to go 1, 2, 3, and you're just going to do a squat. So we did, tried a couple times, and she was really scared. And her husband was like, come on, Janice, this is your fear talking. She ended up doing 10 squats. And I said, see, no one can tell you you can't do something. Your legs still work. Granted, neurologically, the communication isn't as great as it once was because she had metastasis in her brain, but she could do it. And that was so empowering for her to be able to regain control over her body. So, that a lot of times people think they can't do things, and more often than not, it's because of their fear. Stacia, you are asking, you already have functional aging. What is just the CES cert alone? Usually it is $549, but if you write me at Andrea@thecancerspecialist.com, we will work out a special price for you and email you back a coupon code. Jan, how could that PT do that? I know, right? They shouldn't be working with human beings. You're welcome, Stacia. Let me see. I think there's a couple. Okay. Questions are coming in different places. So sorry, I'm not too good at this. All right, Sally. PT is 76, tall man can't. Oh, okay. So you're talking about a client with the Whipple procedure. Pooping in the, all right. So Sally's saying, are you talking about doing squats? You use a pooping in the woods analogy. It's funny because I have some silly little analogies too. Like when I'm trying to get people to do Kegels, especially if it's a woman, I'll tell them as they're coming up out of a squat to think about drawing a soda bottle upwards with their, girly muscles. So, hey, whatever, it works. So I'm assuming that this example of 76-year-old man can't eat, has lots of pain, willing to do most things. I'm assuming that's your Whipple procedure guy. So it sounds like this is pretty complicated, and I'm certainly happy to talk to you about him. And, I would say to you, this training would be very beneficial, not just for this client, Sally, but for any others that you work with in the future. And it also helps to protect you legally by having that particular training, but not trying to do the hard sell. I'm happy to talk to you. Shoot me an email and we can elaborate on that even more, okay? All right, let's see. All right, cool. All right, you guys, well, time's just about up. I'll give you one more chance to pop any questions out there if you have any. Otherwise, check it out. Definitely come back for the webinars this week with Dan and I. We will send out the recordings. And you can share those with any friends or family you think would benefit. And if you'd like to just check out the course, the curriculum, non-committal, go to ceti.teachable.com. If you're ready to sign up, use code Kickstart 2021. And if you need pricing for one course or the other, just write me at andrea@thecancerspecialist.com. Thank you all so much for being here. I truly appreciate you taking the time out of the day to join me and to want to learn more about making the lives of cancer patients that much better and more special. Take care.